Mine would be just to get yourself aware, educate yourself. That there's no official education programs provided by any official bodies in Australia. There's some starting to be developed. I'm personally involved with some that are being developed now for release very, very soon. But generally, do a bit of reading. Look beyond what you're told in the news stories or what your parents or society's told you, and look into it a little. If you're uncertain, refer a patient or two to a specialist clinic, or try some very simple oral medications for basic pain problems, say, on your own patients. But look into it, be aware, be open to the possibility that this medication may be beneficial and may actually help you as a doctor become better at helping your patients.
And I think the other thing I'd say to doctors doing that too is to be a little bit cautious, because this does work. It is going to keep growing. And if you're so vocal about being very anti-cannabinoid medicine now, that's going to stick. And in down the track, people will remember how anti you were for something that is a very effective and safe medicine and is quite life-changing for some people.
Exactly.
So I think if you've got a story that is a story, possibly just keep that to yourself and do what your patients are asking you to do, which is investigate this or refer them to someone who knows about it. That's their choice. That's up to them.
It's very easy to write a referral letter.
Yeah.
You know, most medical software will spit one out for you pretty much instantaneously, and you just sign it. Yep. Please review my patient for a possibility of use of cannabis medications.
And it's simple. You know, the refusal to refer that patient doesn't damage us. You know, it damages themselves and
I
their
think
patients.
that's potentially medical negligence if you're not providing that care to someone, especially if they directly ask you for it.
Exactly.
So rather than just outright refuse or refute that patient, do a little bit of research before you say no, and have a maybe at least in your mind, and hopefully yes.
Yeah. Yeah. I mean, I think everyone has a story of where cannabis has had negative effects in people's lives, whether that's someone in their family or friends. You know, and that's fine. But we've all got stories of where alcohol's had negative effects in people's lives, and where opiates have had negative effects in people's lives. So to say that this plant, to put it in a separate box, it doesn't make any sense, because everything we have in medicine and life can cause damage. It can be used badly, you know? So it's sort of silly to sort of separate the plant and say, well, I had a bad experience with it. Well, how many bad experiences have you had with alcohol, you know?
Even more to the point, the negative experiences are not in regulated dosing settings.
No.
You know, the negative things that happen to people are often associated with other recreational drugs or alcohol. The dosing levels are far too high for that patient's experience level.
Yeah.
These are things that aren't taken into consideration when someone passes you a joint at a party. You're already drunk, you have a few inhales of that cannabis, and then you get sick and nauseous and green out. You know, that's a negative experience. That won't happen in a clinical setting using these medications with supervision. It's just not going to happen if done as directed.
No.